A controversial app is under fire, accused of promoting cosmetic surgery to children. The app, called Beauty Clinic Plastic Surgery from the gaming company Bravo Kids Media, is drawing attention for turning medical procedures for the sake of beauty into a game.
Here's how the app works. Users can perform different plastic surgery procedures like nose jobs and lip injections on animated characters to drastically transform their appearance in an effort to give them the perfect look. The game is just one of many similar apps being targeted in a Change.org petition that's using the hashtag "Surgery is not a game." It's calling on Apple, Google, and Amazon to remove the games or make them less appealing to children. That petition already has more than 120,000 signatures. Plastic surgeon Dr. David Cangello is here to talk more about the controversy these types of apps are causing. Good to see you, Doctor.
Nice to be here. Thanks, Vlad.
So, first of all, I should point out that according to something I've seen, Apple has said that this one particular app that we're focusing on has been removed from their store.
And they do put sort of a bit of a warning on there in terms of that it's not age appropriate for children. So it's like something that parents should be aware of. But it is super cutesy, cartoony. It's the kind of stuff that's typically children will be drawn to.
And I wonder, does an app like this, do you feel, targets children in an effort to get them to become interested in plastic surgery at an early age?
Yeah, I think that it may, Vlad. I can't say for sure, but certainly when you look at some of the images in the app, they certainly look like they're geared towards young children. And, the concern is that this is unmonitored, and young kids have access to these apps. And so, at early ages, we want to be promoting, positive self-body image and things like that. And I think that this is a subject, plastic surgery is a subject, particularly cosmetic surgery, that is more of an adult subject. I mean, there are things we just don't talk to our kids about. We don't talk to them about alcohol. We don't talk to them about sex, and until they're emotionally and age appropriate. And I think that cosmetic surgery sort of fits into the same sort of subject matter.
Right.
So.
And there are some, to be clear, there are some procedures that children and their parents may decide that they need. For example, when kids get rhinoplasties, and you talked about, what's the ear one called?
Otoplasty. So, and I agree. I think that there are different subsets of cosmetic surgery or plastic surgery that would be considered acceptable in children. I don't think there's any debate that reconstructive type procedures for kids who have craniofacial anomalies, that's certainly acceptable. I think there's sort of a borderline subset where you'd get a group of people that might disagree with this, and then other people that would agree. Things like otoplasty, young kids who have prominent ears and they get teased and bullied at school, and fixing that situation can really have a positive impact on kids' self-esteem. And so certainly there are people that wouldn't argue against that. Same thing with rhinoplasty. That really improves self-esteem amongst kids, and we know that to be the case. But when you start talking about sort of different procedures, things like liposuction and lip augmentation and that kind of thing, then I think we're sort of getting into that area where these decisions to have these kinds of procedures should be made by people who are, emotionally mature enough to make these decisions. Not necessarily.
Were you struck by the fact that, and I couldn't download the app, but that it appeared to focus on girls?
Struck, but perhaps not surprised.
Yeah.
I mean, when you look at the company, they have a number of sort of plastic surgery-esque games, and they're all women. But I think, the concern is that the message that we're sending young girls, or the people who play this, is that the way you are is not good enough, but also there's only one good way to be. That you must have this type of nose and this type of stomach or whatever. But I think about sort of body image issues, and I think about teenagers. I don't think that it's something I need to be concerned about with my 6 or 7-year-old. But I want to ask you, Doctor, are kids at a younger and younger age becoming more aware of their body, more aware that something might be wrong, they're not good enough?
And that there's a fix.
Definitely. I think that, we're in a different age now where social media is very prominent, technology is different. When I was a kid, in order to look at myself, I had to get up and go to the bathroom and look in the mirror. And now kids have smartphones that have cameras on them, and they're constantly taking selfies and pictures, and so they're always analyzing their appearance. And not only are they analyzing their appearance, but now they're posting these pictures on social media, so they know that the whole world is going to see these pictures, and it's essentially a permanent, photograph of them that will be out there forever. So there's no doubt that social media has sort of changed the game here, and I think that I've actually had patients come to me, young girls who, 17, 18 years old, who want rhinoplasty, because that's a procedure I perform a lot of, and they've said to me that they're uncomfortable holding the camera at a certain angle because it highlights their nose, which they're unhappy with. So
that's really interesting because of the camera.
Absolutely. Wow. Well, not just the camera itself, but just the fact that they're catching themselves at a certain angle that they don't like.
Yeah.
So do you think these sort of games normalize plastic surgery? And I want to find a different phrase, because obviously you're a plastic surgeon. You think plastic surgery is a good thing for certain people under certain circumstances. But there must be a concern that people may take a cavalier approach towards it when you see games like this.
It's a quick fix.
Absolutely. And one of the problems with this game in particular is that they've sort of equated plastic surgical procedures to things like normal
like going to the beauty salon.
Going to the beauty salon, exactly. Getting your hair done, getting your nails and lips done. And we all know that plastic surgery is surgery. By and large, it's safe. These are elective procedures that we do, and if they weren't safe, we wouldn't be performing elective procedures regularly on people. But certainly there are more risks than those type of procedures, and we don't want to minimize those risks.
So here's the question: who should bear the responsibility of making sure children aren't exposed to these plastic surgery apps? Tech companies or their parents?
In my opinion, I think it would be a little bit of both. I have a 5-year-old daughter, and if I saw her somehow come across these on YouTube, I would have her stop watching them, obviously. So, in my opinion, as a parent, I think the parent should have some responsibility in this. But at the same time, I think that if we know that the tech companies are sort of putting something out there that could be detrimental to kids, particularly in an age where kids are very self-conscious, we have problems with bullying and that kind of thing. There's no point in sort of contributing to that by adding to issues of self-esteem and self-image.
Let me ask you from personal experience.
We should point out to people that what we have up on the screen are statements from Google and statements from Apple, discussing this app and their policy towards it, so you can read how they're reacting to the controversy here.
Let me ask you from just your own personal experience. If, for example, a parent comes in with a child, the discussions that you have with the parents around whether or not it's appropriate to have elective cosmetic surgery beyond the ones that are sort of normal, are those difficult conversations? Where do you think that the parents themselves, for a parent, it's one thing for a child to see an app like this and think this is kind of a fun way and I should probably look into this. It's another for a parent to bring in a child and say, I'd like to give my daughter, a lip injection, or I'd want to do for my son a liposuction.
Well,
do you see that?
I was going to say, that's a good question. That's actually not something I see, which is a good thing.
Yeah.
It's a good thing. The types of things I see with kids are the things that we sort of mentioned. I mean, we do have 16, 17-year-old girls who come in for rhinoplasty. That's not uncommon.
That's normal,
it's normal. And as I say, it can really improve a young person's self-esteem by having a more balanced nose and balanced face. So I think those things are reasonable. It's also important to say that when we do have these discussions, both with the kids and their parents, we do make sure that kids they understand what's happening, that they're not doing it for the wrong reasons, like, there's a boy that doesn't like me because of my nose. And so we wouldn't undertake these procedures for the wrong reasons. And so there is a lot of emotional, sort of psychological screening, if you will. And I talk to the parents, I talk to the patients, and make sure that it's appropriate in the people that we select for these procedures. But just to sort of clarify, I'm not seeing kids coming in looking for lip injections and things. Maybe kids in their late teens, early 20s, because they see Kylie Jenner and all these people who are very vocal about it on social media, that kind of stuff. But by and large, also, as plastic surgeons, I think we're a responsible community, and we're not just sort of doing these procedures willy-nilly on anybody.
My mom is still, to this day, I think I told you, right? My mom will sometimes text me and say, you should really get some Botox, Vlad. And I'm like, I swear to God. I mean, she's probably going to hate that I'm saying this on the air, but she all the time will say, just a little Botox would be very beneficial for you. And I'm like,
the fortunate thing for you is somebody who does it.
I'm trying to resist it. I'm like, Ma, I don't need Botox, right?
No, he didn't say no, you don't need it at all. He was like, hey, I have a business card if you need one.
Dr. David Cangello, thank you so much for coming by.
Thanks
really
for
fascinating.
having me, guys.